Llefarydd UKIP.
UKIP spokesperson Caroline Jones.
Minister, last week a widespread failure in the NHS IT systems caused chaos for GP practices and hospitals across the country, with many GPs reporting that they were unable to access patient records. One GP described the situation as very frustrating and rather dangerous. Hospitals were unable to access test results, and one patient was told he would have to wait another month for the results of a biopsy due to the backlog caused by the system's failure. I hope you would agree with me that this is totally unacceptable. Cabinet Secretary, can you update us further on the reasons for this outage and what lessons, if any, have been learned?
Yes, I recognise the inconvenience caused to staff and patients in the National Health Service following the incident last week. It's not thought that it was a cyber incident on the positive, and indeed it was a technical issue that was, although widespread, all affected systems were returned to normal by 8 o'clock on the same day. There's a challenge about having caught up with any potential delays and backlogs. Further work has been done today to provide a new firewall, and my understanding is that our systems are in a fit and proper place to move forward. But there is, of course, a broader question about investing in IT to deliver more in the here and now and in the future.
Thank you for that answer, Cabinet Secretary. NHS Wales Informatics Service have just announced the new contract for the GP clinical systems and services will be awarded to Vision Health Limited and Microtest Limited. This has caused concern for many GP practices that use systems provided by MS Health Limited. GP practices have been told that MS Health Limited did not meet a number of the necessary tender evaluation criteria and that MS practices will need to choose an alternative system. Cabinet Secretary, can you expand upon the reasons that MS Health Limited was not successful at the tender stage? Is it related to the news that NHS Digital have imposed significant penalties in the order of millions of pounds for failing to meet contractual requirements of the GP system of choice contract in England?
I should start by saying it was remiss of me not to thank NWIS staff who worked hard to resolve the technical issue last week to make sure the disruption was not more widespread and indeed, as I say, was resolved within the day. On EMIS and the issue of system to support GPs, I recognise it's a challenge because a significant number of GPs currently use one of those systems. I can't go into the full reasons for it because there's a period of legal challenge, so I can't make a full statement until that point in time. But members, I'm sure, will be interested to know the BMA have issued a very brief statement because the General Practitioners Committee of the BMA were engaged in the discussions about the future tendering, and they themselves have said that they recognise that whilst it's difficult, they think the right choice has been made because minimum standards have to be met within the contract process. But I think it will be towards the end of next week or the start of the week thereafter when the legal challenge process will be over, and if there is no challenge, a fuller statement can be made.
Thank you, Cabinet Secretary. Whatever the reasons for decision against MS Health Limited, this affects many GP practices across Wales who have been using the MS system for many years. The Royal College of GPs are concerned that this will have a detrimental impact on both GPs and patients due to the scale of the changes needed to move to a new system. There are fears that this could risk pushing older GPs to an earlier retirement. Cabinet Secretary, how do you plan to address the concerns that an already overstretched profession does not have the time or resources to move to a new IT system? And are you confident that the new systems provided by Vision and Microtest are robust enough to prevent failures like we saw last Wednesday?
Yeah, I think that the issues are different with respect. The issues about the data centres I don't think are the same as the software and support that we're talking about to support GPs to work in their practices. And I go back to the statement made by David Bailey, the chair of the BMA Welsh Council, who is also a GP himself, and his practice actually uses EMIS systems, and he's recognised that it will be a problem, a practical problem for GPs in migrating to a new system. And that's why conferences have already taken place about the required training and support to help migrate practices into a new set of software that meets our requirements for the system that we have to run here in Wales, and that's the point. We have to have a system that supports the aims and objectives and the way we want to run our system here, not our system being driven by the demands of an external software supplier. I do recognise the practical challenges about whether, if GPs don't feel supported in doing this, some may make a choice to leave the profession earlier than we would, of course, want them to do so. That's why the continuing nature of our conversation with both the BMA and the Royal College of GPs really do matter. I want to be assured there is a real will and commitment from the government and the wider health service to support them in doing so and continue to provide excellent, high-quality care to every community in Wales.
Cwestiwn 3.